You have to spell it out and you have to tell it like it is. This is a deeply criminal state, which should never be allowed to get away with this. It's not only accountable, it's punishable.
The Electronic Intifada.
The Electronic Intifada.
The Electronic Intifada.
This is the Electronic Intifada Podcast. I'm Nora Friedman.
And I'm Asa Stanley.
And welcome back to the Electronic Intifada Podcast. I'm Nora Friedman with Asa Stanley, and we have a fantastic episode for you today.
Yeah, we've just filmed an interview with two Palestinian doctors, medical doctors, and it went really well, I think. Nora, how do you think it went?
Absolutely. I mean, I think, so when we talk about, Israel's vaccine apartheid, which is happening right now, and has been, Israel denying Palestinians under its military occupation access to the vaccines and blaming them for their own health outcomes. Of course, Israel being the occupying power and obliged to follow the Geneva Conventions and all international laws that pertain. It's important to really expose Israel for what it is. And, you'll hear Dr. Ghada Karmi talk about the, how important it is to understand Israel as a colonial apartheid state. And so everything that Israel says it's doing, we're a vaccine leader, we are, the startup nation, using all this wonderful technology to inoculate our citizens. It's important to understand that is a essential public relations campaign meant to distract the world from the crimes that Israel takes part in every day as a settler colony state.
Yeah, it's like when South Africa used to say that it was sort of bringing civilization to Africa, right? Because
people are so much better off, right? Yeah.
Yeah, the apartheid white supremacist government of South Africa, presented itself as this bulwark against communism and its outpost of civilization amongst the so-called savages. And Israel portrays itself in very much the same way, and its attitude towards the vaccine is another illustration of that, and it's a really stark illustration of Israeli apartheid. And former Israeli Prime Minister Ehud Barak, from the supposedly left-wing Israeli Labour Party, used to refer to Israel as a villa in the jungle, So presumably, in this analogy, the Arabs are these wild animals or, naked savages amongst this sort of colonial villa in the jungle, and that's Israel.
Right, and that's been normalized, that shockingly racist, just disgusting colonial smear campaign against Palestinians is very normal. It's a really. I think it has opened a lot of people's eyes. I think. You'll see you'll see in the interview now with Dr. Ghada talking about how Israel is still not held accountable for these crimes and does get away with all these things, and what we need to do to try and change that. But I think on the popular level, this situation is really stark. You've got a situation where Israel claims, we're occupying all our citizens. We're vaccinating all our citizens. But the reality is that you've got about roughly 6 million Israeli Jews and roughly 6.5 million Palestinian Arabs living in historic Palestine between the Jordan River and the Mediterranean Sea. Roughly more or less equal in terms of population numbers. Maybe a little more on the Palestinian side. It's a little bit uncertain, the exact figures, because these are obfuscated by the Israeli regime. But more or less, it's roughly 50-50. And yet 5 million Palestinians
living in the West Bank and the Gaza Strip, the vast majority of Palestinians have absolutely no entitlement to vaccines from the government that rules their destinies, the Israeli government, the Israeli occupation government. And it's a really stark illustration of what we mean when we say apartheid.
I'm really excited that we also got to talk to Dr. Osama Tanous. He's a physician based in Haifa, and he talks about the the machinations of Israel's apartheid, in vaccine apartheid, medical apartheid, and how it also furthers the settler colonial state, and it just absolutely essential analysis from both Dr. Ghada and Dr. Osama.
Thank you to all our listeners and viewers for this is the second week that we've been doing the podcast with a video version available on YouTube. And yeah, we've had a lot of good feedback with it so far. Still a learning process for us, so forgive any sort of any rough edges that we have. So yeah, thanks a lot for supporting us, and
subscribe.
Like this video. Yeah, hit the like button. I've got to get used to doing that. Smash the like, subscribe.
We really appreciate
it. We haven't added the graphics and stuff yet. I'm sure we'll get to that soon. But yeah, it's seriously subscribing to our YouTube channel. helps with the algorithm. Basically, these Silicon Valley companies have got really obtuse algorithms. It's all a bit of a mystery, and we don't know how. They dominate our destinies in lots of ways, right? So if you interact with this video, comment on it, like the video, and subscribe to our channel, it will help to grow our readership and viewership at the Electronic Intifada.net. So thanks very much.
Welcome back to the Electronic Intifada Podcast. I'm Nora Barrows-Friedman in California.
And I'm Asa Winstanley in London.
Let's get right into it. Today we're going to be talking about Israel's vaccine apartheid and how occupation and colonialism impacts not just COVID-19 outcomes for Palestinians under occupation, but public health in Palestine overall. Joining us are two physicians, writers, and experts on public health in Palestine, Dr. Osama Tanous, joining us from Atlanta, and Dr. Ghada Karmi in London. Thank you both so much for being with us on the Electronic Intifada Podcast.
Thank you for having us.
So let's start with you, Osama. If you could talk about the facts on the ground in Palestine right now, what does it mean to have 5 million Palestinians under occupation blocked from getting the vaccine by Israel, while Israel is sending, for example, this week it was revealed, Israel is sending other countries extra vaccines of theirs in exchange for political support. What does paint us a picture of what it looks like right now?
Yeah, thank you, Nora. Well, I think when you ask about Palestine, it's another opportunity to remind our audience that Palestine is a fragmented geographical unit, right? And this really correlates to the whole entire crisis that, when you want to try to define where is the occupied Palestinian territories, where is Israel, where does this start and where does this end? It's all basically, we need to remember that geography and that fragmented geography has been created by the colonial expansion, right? By frontier colonial expansion. So you have, Gaza, which is also an artificially created piece of land, created and bordered by the Israeli, expansion in 1948, also the West Bank. And then you have settlements inside the West Bank that kind of have Israeli sovereignty on them and connected to them, versus the rest of the West Bank that is an entirely fragmented also geographical piece without sovereignty on the land, right? So what we see as Palestine and Israel-Palestine is a very fragmented geography with a different healthcare system. So while the Israeli healthcare system is a kind of strong, developed, well-established, also, to remember that started before 48. It started as a settler-colonial infrastructure to support the colonization of Palestine. and then it really had sovereignty on the ground, had funding and good planning and so on. The Palestinian healthcare system generally, as of the rest of everything in the occupied Palestinian territory, was a product of occupation, of not having sovereignty on the land, not having import-export, not being able to really conduct health policies. And this is why when we talk about healthcare in Palestine, we talk about a very fragmented and weak healthcare system that compromises also of governmental actors, of non-governmental organizations, of the UNRWA, of profit organization, and all of that in a chaotic, mishmash of different actors who work also on the ground, but you have different shades of accessibility, different kinds of insurances, and in Gaza, it's completely under siege. So also that weak healthcare system is under the control of Israel, basically, because it cannot import on export. And that is why you have such huge differences in the healthcare provision. But that also comes to emphasize that Israel has a legal duty to vaccinate the Palestinians. Israel is the occupying power, although you have the Palestinian Authority as a local governing body that kind of has some kind of limited authority in some places of Palestine. It is by no means the ruling body. The ruling body in all of Mandate historical Palestine is the Israeli occupation. The vast majority of the West Bank is Area C, so it's under Israeli direct military control. And according to the Fourth Geneva Convention, the occupying power has the duty to provide healthcare to the people it occupies. That, of course, is paradoxical when we think about why would an occupier who occupies a population want to deliver healthcare? Why would it want its best if it's really trying to make it subhuman, to occupy it, to exploit it? That comes because occupation was never meant to be something that is long-lasting. Occupation was meant to be temporary, and that's why you have these laws to allow occupation to be non-sustainable and to be exhausting to the occupying power. This is not the case in Israel. Israel runs a kind of a very easy occupation that doesn't cost it a lot. To the contrary, it benefits it because it has a huge captive market of also workers and market that consume its good. And this is why, and from that, Israel is not fulfilling its duty of providing vaccination to the Palestinians. So if you want to see the facts on the ground, we can see a very well-oiled machine inside the 48 areas inside Israel that runs a massive vaccination campaign. Versus in the Palestinian territories, the occupied Palestinian territories that are dependent on Israeli permission, even for the entrance of COVID tests, of vaccination, of whatnot, of the entire healthcare system, then you have a very chaotic. Also, we need to mention that the PA is being nothing but professional or transparent in that sense. So also how vaccinations are being distributed or to whom they are being distributed and what criteria and so on. Of course, the PA is not a good model for ruling, and it has never really paid much attention to the healthcare of its population. It has invested massively on security forces and so on. Of course, security that doesn't provide security to its population and has neglected healthcare. So you have very different landscapes if you're in Israel or Palestine.
Yeah. Osama, you've written for the Journal of Palestinian Studies last year about the public health emergency during the COVID-19 pandemic. And you argued that, quote, the healthcare system, an essential pillar and infrastructural foundation of the settler-colonial project, is naively imagined as an apolitical, neutral sphere. Throughout the process, settler militarism, settler symbols, and settler domination have continued to be normalized. Could you talk a little bit about that and about how Israel has taken advantage of the pandemic to further its own ends?
Yeah, definitely. Yeah, I wrote that it was in the peak of the pandemic when Israel has completely militarized and securitized the pandemic. So you saw different actors. First of all, in Israel, it's a heavy militarized country and heavy militarized state. So it's very hard to distinguish, between the civil sphere and the military sphere, because everything, whether it's academia, healthcare, everything is very much militarized. But when the pandemic had, although Israel has a very, as we say, sophisticated healthcare system, it really brought in different actors like the Israeli intelligence, the Shin Bet and the Mossad to kind of take over, and they were, tracking the patients with COVID. They were sitting facilities for quarantine, and we saw a heavy militarization of the mobilization of the army into the hospitals and into the towns, in order to provide the testing centers and vaccination. And this is incredibly, for the Israeli society, this is normal because they are mostly, you have a obligatory military, they are part of the military and so on. For us Palestinians in that healthcare system, it was alarming, to see the military becoming so normalized as a normal acting body, being it, in our towns, inside the hospitals where 20% or something of the physicians inside the Israeli hospitals are Palestinians, from Palestinians inside citizens of Israel, also regarding nursing and the entire staff. So in that, and what really struck me is that you had Israel was kind of trying to celebrate its healthcare, and it was really celebrated in the New York Times, in Washington Post, how successful and beautiful this model is, where you have Palestinian and Israelis working hand in hand and so on. So like this, united front. But that even was militarized. It was described as brothers in arms, as if like both of us are soldiers in the front line of so the whole description of COVID and fighting COVID became completely militarized, and even Palestinian doctors starting using militarized jargon for describing themselves, as like militant on the front. And that was like really alarming for me, and I really needed to state that how these processes, if you're not aware of them, they can really infiltrate you so slowly, and then they become normalized and hyper normalized. So it becomes completely normal seeing army inside the hospitals, seeing the army not as an occupying army, but as something a normal actor in the management of the crisis. So it was really important to stretch that out, and it was really surprising even for main physicians were kind of adapting these symbols quite normally.
Ghada, I want to bring you in as well. Can you talk a little bit about the what you think about when you see the incredible Hasbara, the propaganda program that Israel has rolled out, that Osama just referred to, that it is, the leading, force of, vaccinating its population, that it's, really just top of the line. It's kind of like the kind of tech washing of Israel as a startup nation, all these innovations. Meanwhile, of course, Palestinians aren't able to get the vaccine, and that usually, when the New York Times or Washington Post talks about it, it's usually at the very bottom of the story that, oh yeah, by the way, Israel is not allowing Palestinians to access the vaccine. There was even a New York Times article in the last couple of days where the sub-headline was, critics say, what was it? It was, Israel gives vaccine to far-off allies as Palestinians wait. And the subhead was, critics say Israel has an obligation to inoculate Palestinians, as though international law was just like a critic of opinion. Talk about what you're seeing and what this says about Israel's, colonialism at this point.
Yeah, look, the way to understand the vaccination story is the same way as one understands anything to do with Israel, politically. There is no other way to see it and to understand it. The context is political, And everything Israelis do has a political aim. And the vaccination is no different whatsoever. Because what's happened is that, as we've just heard very ably, I must say, from Osama, what's happened is that Israel is indeed a world leader. There's no question in the vaccination program for its own citizens, one has to stress. It's very far from that for the Palestinians. And what we have here is a classic example of apartheid in the medical sphere. The fact that Israel promotes this and has a very good, slick PR operation is not surprising. It's something which we've seen from Israel for decades. They just apply it to the same thing, only they apply it to a new field, whatever that might happen to be. The extraordinary thing about all this is that the facts, which are really shocking, the facts are shocking. The extraordinary thing is the way that it's accepted. It's accepted in the Western world as somehow that's the way things are. You pointed to the New York Times article. Of course, there are many, many more that accept the subtext behind Israel's success, i.e., they don't do anything for the people that they rule, the half of the people they rule, whom they give nothing to, no rights, no nothing. And what I think about it is that if you look at the facts, you see that Israel has offered the Palestinians a miserable 5,000 vaccine doses. And even that, barely. They held up in the last week, they've held up a consignment of vaccines from the Russians, of the Russian vaccine, held them up for 2 days. No reason why, they just spite. And the attitude to the Palestinians under their rule, I don't like the word occupation, they just simply rule them. The Palestinians under their rule is one of clear apartheid. Now, we know that Palestinians are paying the price because nearly 200,000 cases have been reported in the Palestinian territory. Over 2,000 people have died from COVID. And that is striking. I tell you why, because the precautions taken by the PA in the West Bank and by Hamas in Gaza have been really impressive. They are well aware they don't have the medical facilities because again, Israel refuses to supply the Palestinians with a sufficiency of ventilators, of protective clothing, of medication, and the Palestinians know it, and they know they have limited hospital capacity, so they had to be pretty careful about public behavior, and they succeeded really in large part because the numbers I'm quoting could have been very, very much larger. So I think we need to acknowledge that and credit them for it. But the irony here is that Israel is not only behaving in a criminal and in an illegal way, it's also a stupid way to do things. If one knows anything about epidemiology and about the way viruses spread, one knows immediately that borders, lines, and so on are meaningless. Now, even with the reduction in Palestinian labor from the occupied territories into Israel, even with that, thousands of Palestinian workers cross over into Israel every day and do jobs for Israelis. They are a source of infection. I mean, it's just completely stupid that they deny them. But the overall point that I wish people would take from this is, first of all, never to accept what Israel says, because almost certainly one finds it's a tissue of lies and deception. Take the legal argument. We know that the occupied territories are subject to the Geneva Convention, and particularly the fourth, to do with healthcare, and that the occupying power has the responsibility, the legal responsibility, to provide healthcare, amongst which vaccinations are very important. Now, the Israeli argument is that the Oslo Agreement of 1993 gave the Palestinian Authority the responsibility for the health care of the population. And if you look at it at first sight and you read what the Oslo Accord says superficially, and it seems to be plausible. But of course it's not, because you look very carefully, you'll see that the things that it does not apply to are vaccinations of this order, of this magnitude. It might talk about measles or something like this, but not this kind of epidemic. So it's nonsense. The whole thing is nonsense. I don't want to take up too much time, because I hope somebody will ask me a question, but I just wanted to say that, honestly, at the end of the day, the case against Israel is proven over and over again. This is an apartheid state, which is a criminal state, which has committed countless crimes against the Palestinian people. But the question is not whether it has done that. It has evidently done. The question is, why do people accept this from Israel? Yeah. Why is Israel allowed the impunity that it is? To my mind, that is the key question about everything to do with Israel.
Yeah. May I add some points to the? Yeah, thank you, Ghada, for the excellent point. I just want to add that it's not just the New York Times or the Washington Post that were celebrating Israel. Even medical journals, like the Lancet, when the Lancet Palestinian Health Alliance published a paper, an opinion saying that Israel has the obligation and the duty to vaccinate Palestinians, they published a really, just only can call it ridiculous paper by some Israeli authors saying that Israel has no more duty to vaccinate Palestinians than England has to vaccinate Irish, and that ironically Israel has vaccinated more, and Israel has vaccinated more Arabs than any other Arab state, and the Gaza Strip, instead of investing in the military budget, Israeli critiquing Gaza of overspending on military. They should look for the healthcare system. So all of that is only being allowed to be celebrated. It is exactly, similar to, I was looking, like you had similar pieces where apartheid South Africa was doing the same claims that, Africans in apartheid South Africa have better outcomes health-wise than Africans in other countries. So the problem is not apartheid itself, but we should invest in South Africa or so on. So that's a point. But another thing then,
before the dawn of limited self-government in Northern Ireland, Britain did have a responsibility to vaccinate the Irish in Northern Ireland, in the part of Ireland that it's still occupied. It absolutely did have a responsibility to do that.
Yeah, so I wrote a response to that with an Irish lawyer. We hope it gets published, so we'll see how they do that. But and on another point, Israel tried to be the leader in also vaccinating non-citizens. So it published that it will start vaccinating asylum seeker, refugees, so on, but not Palestinians. So it would say, and it clearly said that by the Ministry of Health, that it would vaccinate. You had these asylum seekers from Eritrea, Africa, even like people without status. Refugees, asylum seeker, foreign workers, but not Palestinians. And then later on, after a few appeals by human rights groups, it said, okay, so people who, Palestinian workers who work in the settlements or in Israel can get vaccinated, but like I will vaccinate you only if I can exploit you, right? So you don't infect me. So it's a very twisted, really logic of like hierarchies of human value, basically, right?
Yeah.
And also inside Israel, we need to know that the Palestinian citizens of Israel, who are 20%, have way less vaccination rate than the Jewish population, also due to lack of access to healthcare. So where the vaccination center were stated in the beginning, now they're more spread out. But also because of lack of educating and hesitancy, right? So marginalized group really have mistrust in systems and medical systems. They have vaccine hesitancy. We see it also in the Black community in the US, where the more hardly hit communities are more hesitant to get vaccinated. Yeah.
Yeah, and in the UK too, black people, a lot of
Yeah.
black people don't trust the authorities for,
For
historical
good reason.
For a good reason, yeah.
Absolutely.
So it's very interesting. It's very interesting to hear that the same applies to Palestinian citizens of Israel, and I've heard within East Jerusalem as well.
As well, and of course, some of the communities are unrecognized. So, if you look at the Naqab, the desert, most of a lot of the Bedouin citizens in the Naqab live in unauthorized and unrecognized villages where they don't have any healthcare infrastructure. So, and instead of reaching out to them, Israel just doesn't do that.
May I make a plea?
Yeah.
Because Osama points to, quite rightly, to the Lancet. I think you'll find, Osama, that it is the Lancet specifically that has done this. And there is a very good reason for that. The editor of the Lancet was put through the most grueling, the cruelest kind of reactions from the Zionists, because he allowed, I know this story very well, it's very sad, he allowed the publication of a letter decrying the 2014 assault on Gaza, signed by quite a number of doctors. For that, the Israelis were after him. And he was invited to Israel. He was given the treatment. Since that time, he has been too intimidated to not to toe the line, because they got eventually to the publishers of the Lancet, who there was a threat to dismiss him from his post. So it's an interesting that you mentioned that, but that, believe me, is the reason for why you saw that in the Lancet.
A few minutes left. You have to jump on another panel, so I just wanted to get your final thoughts on the time right now and how critical it is for.
I can stay for a bit more. So.
Oh, okay, good. Yeah, if you could talk maybe about just how critical it is right now for international law to be followed in all aspects of Israel's colonialism, obviously, but specifically around the vaccination program, and we see in Gaza just the deliberate deterioration of the healthcare sector because of Israel's violence and colonialism. How are physicians even able to address COVID under the confinement of Gaza right now?
So I've had the opportunity to work also in healthcare in Israel, in the West Bank and in Gaza, to volunteer in mobile clinic in the West Bank and Gaza. So I can kind of have an image. And I think in the occupied Palestinian territory, we need to remember we haven't seen the pandemic started later. I think we haven't seen the peak of it by now. And if in the beginning people were really careful, and really the PA did and Hamas did a good job in trying to curb the numbers, but the economical situation is so hard that you can't simply and people cannot. These are not jobs that people are working from home with the internet and so on, and the schools are not equipped with also all the digital equipment. We haven't seen the peak, I think, of the pandemic. It also hit much later than it did in the US and in Israel. And we need to remember two protective factors. Like they are paradoxically, the Palestinian population is way younger than the Israeli or general Western population, and we know that COVID hits much more or kills much more elderly population, and that might explain why the numbers are yet not that catastrophic. But still, if we need to do age adjustment to the Israelis, and that it doesn't have nursery houses, so we elderly residencies. And that was some of the hot spots, in New York and in other Western cities. So I definitely think we haven't seen the worst. The worst is yet to come. We can see it with an alarming number of positive tests coming. Although you have a limited number of testing is quite highly positive. So it's very it's a much more morbid society. If in the US people are always talking about pre-existing condition, in Palestine we can generally talk about occupation as a pre-existing condition that makes the entire community has much more diabetes and hypertension and heart diseases and lots of other and much more higher percentage of smoking. So it's practically virtually impossible to practice a healthy lifestyle if you are living in a refugee camp, and of course there's a class element if you're not wealthy, and so on. So I think we might see an alarming number in the near future, and that's why it's very urgent to try to get the vaccine. And we know that the vaccine Israel has more vaccination than it needs now, and it's trying to distribute vaccines based on these political alliances and political gains to Guatemala or Honduras or different countries. And that is absolutely ridiculous. So it should be definitely held accountable. And of course, each moment is precious. And you can think about any workers. You're talking about communities that are large families in small houses in crowded cities with no healthcare infrastructure, without a lot of abilities to do social distancing, and without without proper water sanitation and hygiene, especially in Gaza. So if you can't practice the preventive measures, you need the vaccination as quick as possible.
Mm-hmm. Yeah, and Ghada, what are your thoughts on where we go from here, and how people listening to this or watching this are rightly outraged? What can ordinary citizens do at this point?
Yeah, good question. One would have thought that Israel had reached the bottom in terms of the outrageous things that it's done to the Palestinians. But every time Israel takes me by surprise, there is still a new low to get to. And my view is that this behavior over a pandemic which has frightened the whole world, this behavior is so unconscionable that I would have thought that people should have been totally outraged by it. And the fact that this outrage is not expressing itself except by the usual suspects is really very disheartening, is all I can say. Nevertheless, we know what we're dealing with. We're dealing with a deeply criminal state. And I never mince my words about this, because if you want to do something about it, you have to spell it out and you have to tell it like it is. This is a deeply criminal state, which should never be allowed to get away with this. It's not only accountable, it's punishable. It has to be punished for the things that it's done. Now, in order to bring that about, it seems to me that people, first of all, must let the scales fall from their eyes. Every time Israel says anything or does anything, they must understand that this is a political act designed to boost the privileges of one particular group of people, Jewish people, at the expense of everybody else. So they've got to understand that is what motivates Israel. Secondly, that it behaves above the law and outside the law. And that is not acceptable for any of us. And thirdly, that the way to deal with all this has to be through action. It can't be through just disapproval and talking and shouting, and it's not going to work. You have to act, and the purpose of acting is to make Israel into the outlaw that it is, recognized by the whole world. It has to be made into a pariah, exactly as happened with South Africa. Great model for us to follow, and I'm very happy to say we already are, because we have a thriving, successful BDS movement, boycott, divestment, and sanctions. And I urge everybody who wants to do something to start off at least with joining the movement and working hard for that, and every other way they can think to publicize, expose this criminal state for what it is. They should consider, with all the representatives of authority, of government at their disposal.
Yes, absolutely. I think that's a perfect way to end this discussion. I am so grateful for the work that you both do, Dr. Ghada Karmi, physician, writer, author, scholar, and Dr. Osama Tanous, physician, pediatrician, and public health writer and scholar as well. Thank you both so much for joining us on the Electronic Intifada podcast, and we'll have links to your most recent work up on the podcast post that accompanies this. Asa, did you want to say anything else?
Just thanks for being with us today on your Sunday afternoon. I guess it's Sunday morning in Atlanta.
Morning.
Yeah. Well, thank you very much for both being with us today on the Electronic Intifada podcast.
Thank you for having us. Thank you for having us. It was a pleasure.
Thank you.
And that's it for the Electronic Intifada podcast. Thanks to Sharif Zakut, our music maker and production assistant. For news, information, cultural features and reviews, and pointed opinion and analysis, visit us online at electronicintifada.net, where you can also post comments and sign up for a daily email digest. Follow us on Twitter at Intifada. Radio stations are free to use this podcast, and if you're listening on Apple Podcasts, support the Electronic Intifada by rating it and leaving a review. On behalf of all of us at the Electronic Intifada, thank you for listening.